Hello everyone, and welcome to HIV, Don't Ask the Internet, Ask Me. I'm Nekan Makolo, Head of Global Patient Affairs at ViiV Healthcare, and I'm going to be your host today because unfortunately Cliff couldn't join us, but he is online, so if you've got questions or comments to make to him, then please do so. And today I'm joined by Mercy Shibemba, award-winning HIV activist and young woman living with HIV, and online by Susan Cole, who leads the broadcasting and communications team at NAM AIDSmap. And she's going to be our community manager today. So please post any questions or comments to her, and she's going to be answering your questions online. And we're going to start in a moment to talk about language and how language affects the lives of people living with HIV and may create stigma. So we're going to pose some questions, aren't we?
We are.
So our first question, and this is where the challenge for me comes, is Mercy, has HIV changed?
Well, that's a great question, Neka, and I think we're in the perfect place to answer that. We're at HIV Glasgow, where we're hearing the latest about developments in drug therapy, and I always say that it's really important that science evolves with language. So the answer is absolutely, HIV has changed. I was born in 1998 at a really lucky time where I'm able to still be alive today, but ultimately we are now in a space where we have U=U, which means that if you're living with HIV and you have an undetectable viral load, that you are unable to pass it on to others. There is, as we're discussing at this conference, incredible treatment options that are available to people. And so whilst HIV as a medical condition has really evolved and changed, the stigma hasn't, and I think that language has a really big part to play in that role.
So can I just pick up on that a bit? So, you talked about U=U just now and how language plays a part, but so how do we communicate the message of U=U? I mean, who knows about U=U?
And that is one of the big, I would say, controversies of, kind of what's been happening, that U=U has not been communicated first to the community of people living with HIV. We know that, some healthcare providers and organisations kind of choose to withhold that information, and so it's really key that, if you are, whoever you are, if you're speaking to a person living with HIV, that you do communicate this message with them. But also for the general public, I think there's a real lack of understanding that HIV has evolved so much that it isn't this condition where we don't know much about how it's transmitted or anything, but actually we know how it's transmitted, we know how to prevent it, and we know how to support people to live full and healthy, thriving lives with it.
Nice. Okay, shall we go to the second question?
I think we should.
Okay. So how do people living with HIV talk about themselves?
I think this is a really key point, because from somebody who has the experience of growing up with HIV, one thing that I think is particularly resonant with people who've grown up is that there's a chunk in your life where you're talking about HIV but you don't realise it, and so for a lot of children they're not told until a particular point where their parents and healthcare provider might feel that they're ready. So you might talk about having a bug, or you might talk about taking vitamins instead of medication. And I think that really speaks to the fact that there is so much stigma, that it is a condition that people don't feel able to share even with people who are living with it. And so for me, I really had to go on a journey to understand, okay, how do I want to talk about myself, and how do I want to say that? So some people, talk about themselves as living with HIV. That's what I find works for me. Some people will talk about being HIV undetectable, which I think is a really interesting term, obviously, with the rise and understanding about U=U. But we are really trying to get away from terms like HIV infected or AIDS victim and, other things that I've heard a lot. And one thing I'd say, particularly to healthcare providers who are, working with children living with HIV, is to really think about the messages that they're sending people. So, for a lot of people, it's like, oh, you're living with, a bug, and it makes it sound really scary. And so that when you do get told, okay, what we're talking about is HIV, you've had all this negative messaging, and I think it's really important. And another thing that I think is really key is, obviously, we've got HIV, we've got AIDS, and I know a lot of people, of course, shy away from that word AIDS, but I think it's really important to remember that not everybody has access to medication, and there are still people who die of AIDS-related illnesses, and I think that we have to be really careful, particularly in a context like living in the UK, to not run away from that narrative because, oh, well, that doesn't matter to me, but actually understand that people are still a part of the community that are living with age-related illnesses, and that actually, yes, we can choose how we define, how we talk about our own HIV, but we've also got to remember that everybody's at a different stage of the journey.
And I think that's the case not just for HIV, but for all sorts of things. You know, I think there's a tendency for us to just think about things in our own context and not to think about the fact that other people have different experiences from us. And so what you're saying is really important. I think before we go on, I do want to just go back to U equals U again.
Yep.
Just because I think, to me, that is one of the most important messages about HIV. So if you were explaining about U equals U to somebody who knew nothing about HIV, what would you say? How would you explain?
So I would say that HIV is a virus, and you take medication in order to lower the levels of the virus in your body. And when you are below a certain level, we call that undetectable, which means that it is difficult for the virus to be passed on because it is in such small quantities in the ways that you would pass it on. And so that is what I would say.
And I'm going to go even further, and I'm going to say it is impossible to pass the virus on sexually if a person has an undetectable viral load in their blood.
There we go.
I think we have to be really categorical about that, because that's one of the most important ways I think that HIV has changed.
Absolutely.
So thank you. Shall we go to question number 3?
I think we should.
We're racing through these, but
are.
hopefully it means we can have some time for a conversation.
Yes.
So, can someone living with HIV live a normal life?
So, I think it's really important with this question to say that normal looks different for everybody.
Yeah.
When I found out about my diagnosis, I, wondered, am I going to be able to go to university, have a career that I love, get married, have children, do all of these things? And the answer is a resounding yes. You can absolutely thrive and live with HIV, but you can only do that if you have the right support, if you have the right treatment. And this is why, again, language plays such a key role, because language and stigma are, inextricably linked together. And I know that, when I was growing up and I would hear different things, it would make me internalize that and think those things about myself, which meant that I felt like I couldn't live a normal life. And I think it's really important that we pay attention to the language that we use, and like we've just talked about, U equals U, enabling people to live a full and healthy life. But there are so many myths. I think one recent conversation I had was that a nutritionist thought that people living with HIV should stay away from eating garlic, and it's such a small kind of funny thing, but actually that could really impact on. So I'd be lost without garlic, and actually we just really need to think about the limitations that we put on people's expectations for the lives that they want to live and deserve to live, through the language that we use and the myths that we might share, and it could be unknowingly, because I think so much about the language piece is that people don't know what they should use. And so my answer is you absolutely can live a normal life, but you will only do that by the support that is around you.
No, and that's really helpful. And I just want to just expand a little bit, because language affects people living with HIV, but it also affects the behaviour of people who are not who don't know whether they're living with HIV or not.
Yes.
Because language determines whether or not a person might come forward to test. And it's really, really so. We have amazing treatments for HIV, and you are, this is the reason that you, as you said, are here today. But people who are scared to test for HIV because they hear, the stigmatizing words that you've just referred to, will say, well, then why would I want to test and then become what they perceive a person living with HIV is, or what they might experience. And so actually it's really important that we think about language in terms of how we encourage people to test for HIV, so that then they can access treatment, and then if they are living with HIV, be found to be living with HIV, they can then put themselves on the path towards having a normal life, whatever that is for that individual, because without knowing your HIV status, you can't take advantage of treatment. So that's,
it's really interesting how language and the labels that we put on people also links to the identities that they hold. And so we know, intersectionality is a really key point when it comes to language, and for different communities, what can be stigmatizing for one might not be for another. But I often say to people that, HIV is really complex because of the different, things that people go through. And I know that, racism and sexism and homophobia and all of the things, interact with the way in which we use language to talk about people living with HIV, and that's another really important aspect of it.
And I just want to pick up again just a little bit on what you just said. Because we've been talking a lot about language in the context of the English language.
Yes.
And some things that in English we think or we perceive to be stigmatizing may not necessarily be stigmatizing in other languages.
Yeah.
And so it's really important that these conversations happen beyond the English language, and that people who speak other languages you won't necessarily be able to understand those other languages, but just that people bear in mind that actually, as you said, what is stigmatizing in one context might not necessarily be in another context, but it's important that people who speak all languages find the words in their languages to use that do not stigmatize.
And this is another reason, we're at a global event, a global space, and actually things like the People First Charter are really causing people to question the language that we use in relation to HIV in a global setting. Yeah. And I know where I've attended conferences and I've been like, this talk was great, but they were really stigmatizing about me, and it's really important that we weed that out, because it can get so lost in a study or big pieces of research, but actually for the people that are living out what that research means, it's really important to be able to be in a judgment-free zone where you feel welcomed, respected and valued.
Yeah. And do you feel that you can say a little bit about the People First Charter?
Yeah, so the People First Charter is a charter that you can endorse, which it's a really good guide for how you talk about people living with HIV, and it's in the name, People First, right? And so it's really trying to address the ways in which people are talked about, not just at conferences, but kind of across the board. And is a really good resource that you should either go and endorse or go and share more about.
And where can people find it? If you're looking for the People First,
I believe it's like peoplefirstkcharter.org or something like that.
And I suppose if you just Google People First,
you'll find
probably find it.
Absolutely.
Thank you. And shall we go to the next one? And I think this is our last one. So, how do you talk to someone living with HIV about HIV? That's a good one.
It is a good one. So I think the first point to say, like we've just spoken about with the People First Charter, is with respect and care, really. I think everybody obviously is a person and really wants that to be considered. And so one of the things I say is, a lot of people are scared to say the wrong thing. But of course people are human, so there are times where we say the wrong thing, and I think it's about knowing that actually your intention is what matters. And I've been in situations where perhaps I've shared my HIV status with a friend or somebody that I'm getting to know, and they'll ask me how should we talk about this, how can I support you? And I think it's a really individual thing, and so I would encourage people to go ahead and kind of in an individual situation, think about that. But I think what's really interesting is that, in particular, in this setting, I know that a lot of people talk about stigma that they hear in healthcare professions, and you'll know, as much as I know, there's a lot of work to do in terms of the language that healthcare professionals use when speaking to patients that are living with HIV. And so, one of the things that I would say in terms of how to talk with someone is that you should stay away from certain key terms, like I've mentioned one which is like AIDS infected, or you're suffering with HIV. That's kind of a really big one that I'm really keen to stamp out in particular. But have you heard any examples in terms of your practice?
I mean, unfortunately, and I'm a doctor, so I know that of which you speak. And unfortunately, you wouldn't think it, but some of the worst stigma happens in healthcare settings. And I'm ashamed as a healthcare professional to say that, but it does. And as you say, I think there's a lot of work that we, as people in the HIV field, need to do to sort of educate and kind of help other healthcare professionals to understand why some of the words that they use are stigmatizing. I have a patient who said to me that in his clinic, the nurse said, could all the AIDS patients come here? And this was in a big sort of open plan outpatient clinic. And they may not have realized, it may not have crossed their mind that they were being stigmatized. But so it's really important that we always think about how the impact and the implications of the things that we say, and be open to people saying actually that isn't quite the right way to speak. So, do you have anything that you'd like to add to that?
Yeah, I just think what you've raised is, really important. And I think the other thing that I think is, important is that people feel able to challenge it when they hear it. And I know that for so many people, I've been in situations where I've heard really stigmatizing language, but I haven't been able to feel that I can. And I would say that if you're someone who's not living with HIV but wanting to support people, that you challenge it, and be an ally in situations where you hear stigmatizing language. And like we've said, language evolves and it changes like it has over the last sort of 40 years or so of HIV. It's really shifted and changed, and it will continue to do so as we grow and kind of develop. And I think that one of the things that I would say is to really be conscious of that, and that this is a health condition that people are able to thrive with, live normal healthy lives with, and it's just a part of people. HIV is not something that defines a whole person, and so when you talk about people living with HIV, that should not be the headline, that's not their name. That is just something that they happen to be living with, and you don't need to define them by that thing.
No, I think that's a really great way to end. And I think actually the thing that you said just before about being an ally, we can all be allies.
Yeah.
And I think that's something really that we should take away from this. Let's all be allies.
Yes.
Right? Allies against stigmatizing language.
Absolutely.
I'm just going to say to everybody a couple of things just before we close. So our next HIV in View conversation episode is going to be on stigma and language, and will be available from this Thursday, the 27th of October, on the ViiV Healthcare YouTube channel. And you can also register for our upcoming community event on Thursday, the 10th of November, when we'll be uniting against HIV stigma. And you can find the registration links in the comments. And so I'd finally like to say thank you so much to Mercy. It's been incredible to have you here.
Thanks.
To Susan for moderating, and to Cliff. I'm sorry that you weren't able to join us, but I hope that people asked you loads of questions in the chat. And look forward to seeing you again soon.
Thanks so much, everyone.